So this is for my capstone class. This is my final class to finish my bachelor's degree. So what we had to do, we picked a research topic. I actually picked it like 4 semesters ago. So when I first thought of my topic, I was a brand new nurse and I was night shift. So I was like, what goes on, what is something that happens all the time? So I picked falls at the time. And now coming to day shift and working with management, when I did scheduling, falls happen all the time. It's not just night shift, it's every shift. Just these last 2 days, we had 2 falls. So my plan is based on making individualized education plans for the residents. We always teach the staff, and we're all about teaching staff, but is there a way that we can educate residents as well about fall prevention? Okay. So the problem that we are going to talk about is the high number of fall rates. And this is everywhere. This obviously is not just here. This is all over healthcare. The setting of interest is here, a 107-bed long-term care facility in southern Indiana. And according to the CDC, falls can occur due to weakness, vitamin D deficiency, gait imbalance, medications, poor vision, improper footwear, and hazards in the home or in the facility as well. So the number one problem, falls are a leading cause of injury in the elderly. The last year they had 800,000 hospitalizations just from falls alone, and a death occurs every 20 minutes, either from a fall or from complications from a fall. Some of the negative patient outcomes for falls for the elderly, one is the fear of falling. If they're scared to get up, scared to do anything, then they're gonna lose their independence. And then just avoiding daily and social activities, not wanting to go anywhere because they're scared to fall. That in turn can lead to depression, mental health issues, and things like that. The third negative outcome is the cost. Non-fatal falls result in $50 billion a year of debt. From surgery, then they go to therapy, or they go to a nursing home, or they have home health, or just the equipment they need, if they break their hip and all the equipment that they need, $50 billion. And then for fatal falls, the cost is about $754 million a year, which is a lot of money. So for this class, we had to look at different literature to make our proposal. So originally what I was wanting to do, I honestly don't remember what my main plan was, but there was no literature to support it. So instead, I looked at the literature out there that's about education. Some of this literature is about educating patients, and some is about educating staff. And then from those reviews, I took what plan I thought would work best for us, and then I made my research. So one of the first studies that I looked at was from an Austrian university teaching hospital. They had 110 participants. They used questionnaires, group discussions, and interviews to determine if testing patient and nurse fall prevention knowledge could prevent falls. So they didn't just look at what do the nurses know, they looked at what do the residents know, and do they understand how to prevent falls. For their results, basically they did this individualized education plan, which is what I'm looking at doing. And for this one, they increased the knowledge, they focused on the nurses, but they increased the knowledge of the nurses from 65.6% to 69.7%. It's not a huge increase right off the bat, but if you would continue this for a long time, you might see better improvements. The second study was in Germany at a senior center. They had 378 participants. They used a timed up and go test, a chair stand test, which basically can you stand up from a chair and hold without falling and things like that. And then they did a daily fall calendar to see if an exercise program can decrease falls. I really think, and I think we say that whenever we send someone to therapy, when they're done with therapy, they're a lot stronger, I think. So, I mean, to me, an exercise program makes a lot of sense as well. They saw in the intervention group, 58.1% did not have any falls, and of their control group, 50.6% had no falls. So the control group that didn't have the exercise program was a little bit lower. The third study was from a hospital in Turkey. They had 91 participants. They used investigator-developed videos, education sheets, and discussions, and they were trying to see if a nurse-made fall prevention program can decrease falls. for their results, their intervention group had no falls and the control group had 2 falls. Then the 4th study was from Singapore. They had 202 participants. They used questionnaires and they were trying to see if a fall video about falls would decrease the rates. So instead of just giving them a sheet about how to prevent falls, an actual video showing the residents and patients, their results, they did show an increase in the fall awareness in the intervention group. And then the final study, this was just conducted with older adults that are living at home. They had 232 participants. They did questionnaires and pre and post tests to see if a peer-led presentation could decrease rates. Could people who live at home educate each other about how to prevent falls? And then it showed at the end the knowledge on how to prevent falls improved, and then they saw an improvement in the intention to follow the measures to prevent falls. So going on to what I'm looking at, my PICO question for this was, can individualized fall prevention education delivered to long-term care residents decrease the number of resident falls compared to no individualized fall education plans? So we had to pick a theoretical or a nursing theory that supports all of this. So the nursing theory that I found that supports this proposal is called the theoretical framework. It uses 10 steps to identify what the main problem is. And then it uses 11 skills to develop a nursing care plan. So this includes health status observation, communication, teaching, and then the use of resource materials. And this, I believe, is related to this proposal plan because I think the 10 steps can be used to identify the problem, and it helps to organize relevant data, includes observing and evaluating the patient, and then creating an effective care plan at the end. We can use this to understand resident and nursing level, their knowledge of fall prevention. And then it can also show at the end, where do we need improvement, or where can we educate both the nurses and the residents. So my design for this, it was a quantitative experimental design. It would have an intervention and control group based in here. It would have 50 participants is my idea. We would have 25 in the intervention group and 25 in the control group. It would have to be based on a little bit of their physical status and also their cognitive status. Obviously, if we have someone who, if you read them the steps and they don't understand it, obviously they're not going to be very beneficial to this program. But I mean, just the 2 falls that we had this last week, both of them could read a paper and understand what we were saying. So that's kind of where this is, it's more looking at the people who can understand what we're saying. And then for their confidentiality, it would be voluntary. We would just ask them as they're admitted, would you like to be a part of this? Everything would be kept confidential and protected. So I created a structured questionnaire, and obviously these are just some ideas of questions, and we can always change them and things like that. But this would be the questionnaire that we would give to the resident either when they were admitted or within their admission date, and they would answer these questions with no help. Then we would basically grade it and see where they're at, and then the information that's on here can help us create an individualized plan to teach them. So say they know I need to hit my call light. Well, then we don't need to educate them about a call light, but they might not know I need a gait belt and a walker. So that is where we would create this education plan. We would do, to make sure it's valid, this can show the improvements in resident knowledge. You know, we can take it before and after and we can see where the improvements have been made. And then it's reliable because it can show us what areas need improvement. You know, like I said, if they don't know how to use a walker, then we know that's an area that we can focus on. For the data analysis, both groups would complete the questionnaire, and then at the end of the study, we would use a t-test to test the means between the control and the intervention groups. So in conclusion, we all know that falls can be very harmful. They can lead to injuries, hospitalization, or death, and we don't want to, this is something that we can prevent, at least to a degree. for us, for nurses, I think fall education is always a top priority, and it's important for staff to be educated, but I think it's also important that we educate the residents as well on how to stay safe and how to prevent falls. And there's my references.